Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. This is a special edition of the Roundup. We're going to be talking about how we can make kids healthy again with Dave Johnson, founder and CEO of Foresight Health, and our special guest, Ann Somers Hogg, Director of Healthcare Research at the Christensen Institute, founded by Clay Christensen of both Disruptive Innovation and Jobs to Be Done fame. Ann Somers also is the former AVP of Strategy and Transformation at Atrium Health, which is now part of Advocate. Ann Somers, welcome to the Foresight Health Roundup.
Thank you so much for having me, Dave. I'm excited to be here.
Now, before we reveal the backstory behind this podcast, we want to hear the backstory behind your two-word first name, if you're up for it.
Sure. So if any of your listeners live in the South, they might not be surprised that I have two first names. That tends to be less abnormal in that part of the country. But as my mom tells the story, she wanted her children to have unique names. So my first name is Ann Somers, named after my grandmother and my great-grandfather. And I always say that I got the good end of the deal because my sister's name was Christian Randolph. When she got married, She got rid of the Randolph part, but she got a draft notice when she turned 18. So, Ann Somers, I just have to explain to some people, but otherwise, I think I won.
I think you did too. The idea for this special episode came from a piece written by Ann Somers and published by Foresight Health on June 3rd. Ann Somers' commentary summarized a new report she wrote for the Christensen Institute on how parents decide to quit sugary drinks for their kids. If you're a parent or anyone in charge of kids in any setting, you know how hard that is. My youngest wasn't going to run in the annual Tiger Trot race sponsored by our local elementary school until he heard there were donuts and juice boxes at the finish line. He never ran a race in his life. He finished third, blew past me at the finish line, and he had a donut and juice box in his hands by the time I found him to take a picture. There's my evidence. Anyway, Ann Somers' piece comes at a time when the Make America Healthy Again movement, championed by Robert F. Kennedy Jr., now HHS Secretary, is getting a lot of attention. The column got a really high open rate, which caught our eye and led to the idea to have her on to explain herself. It's no surprise that Ann Somers' piece was popular with our audience. Healthcare industry leaders are caught up in the MAHA movement and caught between volume and value as a business model. What we're going to do is dig into the recommendations Ann Somers makes for the provider and public health sectors to help parents get their kids off sugar-sweetened beverages. Now, before we do that, let's talk briefly about what the Jobs to Be Done approach is. Ann Somers, explain that to us, please.
Sure. So Jobs to Be Done, also known as JTBD or just Jobs, is a tool to better understand consumer behavior. And effectively, it's a way to uncover how and why people make the decisions that they do. We say that Jobs to Be Done have two parts. It's the circumstance or the situation that someone is in, and then it's the outcomes that they're seeking. So the job to be done is both of those things, the circumstance that they're in and the outcomes that they want. And jobs research is really useful because it extends beyond general demographic categories and an individual's characteristics. It really uncovers the functional, social, and emotional factors that drive someone's motivations and how those factors impact decision-making. So Jobs to Be Done really gets at the why and the how decisions are made and not just who made the decision or what they decided.
Just like a good news feature. Dave, you have some thoughts on Jobs to Be Done?
Well, anybody who reads our content know I'm a devotee of Clay Christensen and the whole Jobs to Be Done way of framing challenges. I think Clay takes it back to work that Ted Levitt did at Harvard, where he said consumers don't want a quarter-inch drill, they want a quarter-inch hole. The drill is just the way to get there. And one of the things I always loved about Clay, when he was articulating this concept, he would often tell the story about a fast food chain that couldn't understand why people were buying milkshakes and did all kinds of things to increase sales, and none of them moved the needle. And so they hired his consulting firm to come in and figure it out. And Clay and team would ask the question of customers, why did you hire this milkshake? What job to be done are you looking for? And it turned out that people were buying milkshakes in the morning to relieve their tedium during long commutes because it took half an hour or so to consume the milkshake. So once they figured that out, the sales really took off because they put the milkshakes at the front of the store and had frequent buyer programs and all kinds of things. And the real key there was figuring out what job the consumers were hiring the milkshake for. So I couldn't agree more with Ann Somers. It's just a remarkably powerful framework for cutting through all the noise and activity and getting to the root causes of what's driving human behavior.
Yeah, well, I've got a few jobs to be done at my house, but that's a different podcast. But maybe I'll start with a milkshake. All right.
In the morning.
In the morning, right? That doesn't sound too bad. Now let's get to the meat of the podcast. Ann Somers, walk us through the 3 recommendations you have for providers, please.
Sure. So in doing this jobs to be done research around what is it that causes parents to quit giving their kids sugary drinks, we uncovered 5 different jobs to be done, and we detail those in the report. But the meat of the report is really, okay, so what do we do with these insights now? And as you mentioned, we had some specific recommendations for providers. So we really targeted that to pediatricians and registered dietitians who are interacting with pediatric patients and their parents. And the first thing I'll acknowledge is pediatricians don't need more to do. So our recommendations are really around how they can leverage the insights we discovered about why parents quit sugary drinks in order to help other parents during their moments of struggle. So with that, from an overarching perspective, we suggest that pediatricians leverage the trust parents have in them. So talk to any parent, they likely trust their pediatrician. And they also trust their pediatric registered dietitian if they happen to have access to one, which is certainly not ubiquitous. But our first recommendation is really for providers to listen for the indicators that a parent's current struggle with their child may be associated with sugar-sweetened beverages. So this struggle could be about a child's current health or fears around their future health. But as we discovered in our research, it's not always about health. Sometimes it's about the child's behavior or the parent's own decisions and how they emotionally feel about those. But first, the recommendation is for providers to listen for what the parent's current struggle is. And then if the parent is struggling with the child's sugar-sweetened beverage consumption, the provider can try to uncover which of the 5 jobs to be done the parent has. And in the report, we provide a list of questions that the provider can ask to try and uncover that job, the progress that they're seeking, and really the struggle that they have in their current situation. So after those first 2 steps, the provider then has the information that they need to speak directly to the parent's current struggling moment and to their desired outcomes. Now, we know from jobs research that using parents' own language about their struggles and speaking to both where they are and where they want to go are powerful levers for change, especially when it comes from a trusted source. So we provide a detailed approach for how providers can go about doing this.
Yeah, to trust, listen, use a common language, all pretty common sense, especially for pediatricians. That's great. Thanks, Ann Somers. Dave, any thoughts or reactions on those recommendations for providers?
Oh, so many. And I absolutely agree with the approach. I'd be curious when Ann responds to my remarks, what jobs parents are currently hiring Sugary Drinks to do, and how do we find substitutes for that? I mean, it's one thing to key into the